Uh, thank you, sir. Thank you, All India Ophthalmological Society, for providing me opportunity to present this topic. ये एक मिनट चलाना, आगे कैसे हो नहीं रहा है, नीचे करना ऊपर करना. I have no commercial interest. Trade names have been given only for the sake of convenience. So I will discuss vaccinations to prevent vaccine-preventable diseases. Topic which is of importance to all of us, to all our family members, and all our neighborhoods. Pneumococcal vaccine. There are two types of pneumococcal vaccines. One is called pneumococcal polysaccharide vaccine. This is a short-acting vaccine, and this is T-cell independent, means does not give immunity as cytotoxic by cytotoxic cells. Pneumococcal conjugate vaccine, or PCV. This is a long-acting vaccine and gives mucosal immunity. There are 4 types of vaccines: 10, 13, 15, and 20 valent. PCV13 has been the commonest available so far by the name of Prevnar. Only one injection is given in throughout life. However, whenever the Prevnar 20 becomes available, this can be given. In normal persons, see, all of us, if we are above 40, don't have any comorbidity, we should get 1 dose of this vaccine. And if a person is below 50 but with certain immune conditions where immunity is compromised, like nephrotic syndrome, chronic kidney disease, chronic steroid use, cancer patients, their PCV13 is given 1 dose and followed by 2 doses of PPSV23 after 8 weeks and 5 years. PCV10 is used in children only, 2 years up to 2 years of age, Synflorix and Pneumococcal. PCV15 is being developed by the Serum Institute of India. This is the picture of injection Prevnar 13. PPSV23, this has 23 different strains of the pneumococci. Immunity lasts 5 to 10 years. Person with normal comorbidities, they are given single dose between 19 to 50 years. But if they are immune compromised, PCV is given first, then 2 doses of these vaccines. And 1 dose is reserved for persons above the age of 65 years. So if we are above 65, we should get this vaccine. But before that, get PCV13. Cost of this vaccine is about 2100. Coming to flu and typhoid vaccines. These 2 vaccines, the doses are same for children, small children 6 months of age, and adults. Flu vaccine is given every year to adults with comorbidities, to pregnant ladies, and all healthcare workers. They should get it. Cost about rupees 2000, except Vaxiflu made by Zydus, 1600 rupees. Typhoid conjugate vaccine, this is the most cost-effective vaccine because only 1 vaccine is given throughout life. If you have been given in childhood, there is no need of this vaccine. 6 months to 45 years, half ml intramuscular. This can be given to persons above the age of 45 also. Cost about rupees 2000. Measles, mumps and rubella. This is of importance to ophthalmologists also because we want to prevent congenital rubella syndrome. So MMR contains measles, mumps, rubella. MR contains measles and rubella. RVAC contains only rubella. So this is given in the preconception period to young girls and to adolescent girls. However, pregnancy should be avoided for 1 month. But as a healthcare workers, we should get 2 doses of these vaccines, and this can be used till the age of 60 years. The cost of pre-filled vaccine is about 600 and 700. Hepatitis A. There are 2 types of vaccines to prevent hepatitis A. One is killed vaccine by the name of Havrix. 2 doses are given at 6 to 12 months interval. In children, 0.5 ml is used, and for adults, 1 ml is used. However, live attenuated vaccine, a single dose is required. Same dose, 0.5 ml for children as well as for adults. Available by the name of BioVac A, rupees 1600 only. Whereas Havrix cost about rupees 2000, and Havrix 1440 1 ml is not available. So 2 vaccines, two injections can be combined for adults. All doctors, they should get this vaccine. Immune compromised persons, only killed vaccine should be used. Hepatitis B, 3 doses are given 0, 1 and 6 months if not given in childhood. In adults, dose is 1 ml. In children, it is 0.5 ml. Boosters are not recommended routinely. One can get antibody level checked. If the IgG level is less than 10, then one can go for booster. Or if a person is above 40 without going for these IgG levels, they can get a booster. When coming to chickenpox or varicella vaccine, this is a live attenuated vaccine given subcutaneously. Cost about 2,000 rupees. All adults, all healthcare workers, they should get it. If they did not get this vaccination in the childhood, or they did not have chickenpox, we should advise all the contacts of herpes zoster ophthalmicus patients that they should get this vaccine. Within 3 days, 70% protection. Within 5 days, 50% protection can be there. And to prevent herpes zoster, another type of vaccine is used, which is called shingle vaccine or the zoster vaccine. We must think that the vaccine virus is the same, but the vaccine is different. Shingle vaccine is not available in India. 2 doses are given above the age of 50 years. Till that time, we can give varicella vaccine. Tdap. Many of us may not have heard the name of this vaccine. Tdap contains full dose of tetanus and reduced doses of diphtheria and acellular type of pertussis vaccines. Can be used in persons above the age of 7 years. When we were students, we were told that the DPT vaccine should not be used in above 5 years. But now this is a different vaccine. Tdap is given every 10 years up to the age of 65 years. If one is not sure of early vaccination, then second dose of TD can be given. Second and third dose of TD can be given. And each pregnancy, 1 dose of Tdap must be given. All the staff of the maternity homes and children hospital, they must get this vaccine, including Safai Karamchari, including the clerical staff. Coming to painful vaccines, when the pertussis component is whole cell pertussis, this is painful, causes more side effects. While acellular type of pertussis component that causes less side effects, it is called painless. Rabies vaccine. All of us should get this vaccine pre-exposure, because these vaccines are not available in every city, every shop, and moreover the antibodies, they are not available everywhere. So if you have got this vaccine pre-exposure, then only 2 doses are required after exposures with no need of antibodies. All healthcare worker and animal handler must get this vaccine pre-exposure. Post-exposure 5 doses are used plus antibodies for class 3 bites. Coming to human papilloma virus vaccines, currently there are 2 types of vaccine, 4-valent and 9-valent. The 2-valent has become obsolete. After the development of 4-valent vaccine by Serum Institute of India, the Cervavax vaccine had disappeared from market. This prevents cervical, genital, oral, head and neck cancers and genital warts. This will be available in the national immunization schedule after a few months, maybe April or June. The government of India is buying 16 crore vaccines for this purpose. Cost of Gardasil 4 is 3,000 rupees and Gardasil 9 is 8,500 rupees. 9 to 14 year 3 doses and above 14 year 3 doses. 3 doses are used. 9 to 14 year 2 doses are used. In each pregnancy, Tdap is a must. This can be followed by or this can be preceded by a dose of TD. Besides that, flu vaccine should be given in pregnancy. Coming to summary, for preconception period or adolescent, whether boys or girls, MMR, RVAC vaccine, flu vaccine, typhoid, hepatitis A and B, varicella, human papilloma virus, and Tdap. And coming to adult 20 year, 30 year, 40 year, 50 years, typhoid conjugate vaccine once only, flu vaccine every year, PCV 13 after 50 years, PPSV after 65, plus with person with comorbidities, varicella 2 vaccines, hepatitis A killed vaccine 2 doses, live vaccine single dose, hepatitis B, MMR, Tdap, zoster, rabies, human papilloma virus vaccine, and Japanese encephalitis. That is used only in endemic areas. In special situations, cholera vaccine, yellow fever vaccine, and meningococcal vaccines can be used, especially those who had physiological or anatomical splenectomy. Thank you. Thank you, sir.
Thank you, Professor Taneja. It is very enlightening because first we have to protect ourselves, then only we have to think our patient. So those who are not taking the vaccine and at their proper time, please be sure that you should take it now itself.
If you have any question about any vaccination, even corona vaccination, pediatric vaccination, you can ask me. Anytime, later also. Thank you.